We have a lot of patients that come see us for pain in their knee. When we see somebody like that, the most important thing is talking to the patient, finding out where they're hurting, what makes them hurt, what things make it better. Eventually, we typically will end up getting an x-ray and examining the patient. And if we find that there's a good bit of arthritis, we'll talk about what the treatment is for arthritis of the knee. Most times we try to do something conservative. A lot of times we can do some therapy or an anti-inflammatory medication for knee arthritis. Sometimes we'll talk about different types of injections. Sometimes we'll do a cortisone shot for the knee, and that may not be a permanent fix, but sometimes can provide several months of relief. There's also a different type of injection that we'll do. It's called hyaluronic acid injection, and it functions basically as a lubricant for the knee. Hyaluronic acid is something that's found in a normal knee. If we saw you when you were 18 years old and we drew fluid off your knee, we would find a lot of hyaluronic acid in the knee. But when we get arthritis in our knee, our body doesn't make that as much, and then we can replace that. If we decide to do that, that usually requires us to get insurance authorization for that procedure, which we do before we give you the injection. Ultimately, if somebody's got end-stage arthritis, where they're bone-on-bone arthritis in their knee, then we can talk about doing a knee replacement. So when we do a knee replacement, what are we actually doing? We'll bring you to the hospital on the day of the procedure. You'll meet the anesthesia doctor. Most times the anesthesia doctor will talk to you about doing a block for your knee. A block is an injection of numbing medicine, so that way you have good pain control after surgery, where you just basically can't feel your leg for about 4 to 6 hours after surgery. So that's really helped with post-operative pain control. After you've had the block for the knee, which is done under a light sedation, then we bring you back into the OR, and that's when we do the actual anesthesia. And they can either do a general anesthetic or a spinal anesthetic. Even if they do a spinal anesthetic, they still give you sedation, so you basically think you're asleep during the procedure. With the knee replacement, somebody's got arthritis in their knee, where basically bone is just rubbing on bone. So when you do a knee replacement, what do? You go in, you make an incision on the front part of the knee, and you basically have to move the knee, you have to move the kneecap out of the way. This is a model that we're looking at of a knee. So we've got the knee cap right in this area through here. So during the surgery, what you do is you just move the kneecap out of the way. This shows a knee that's already been replaced, but the idea with the knee replacement is you go in and remove the spurs off the end of the femur bone. So this is your femur or your thigh right through here. This is your tibia bone. And so during the surgery, after you remove the spurs from the femur and the spurs from the top of the tibia, then you replace where you removed the spurs with metal and plastic, basically. This part right here is just your own ligaments. These are the ligaments that help hold the knee together. And then people will ask, what do we do about the kneecap? Well, we move the kneecap out of the way just so we can see. And then if you've got arthritis behind the back part of the kneecap, we can remove the back part of the kneecap and just replace that with plastic there. And then that plastic articulates with the femur right through there. So when you're replacing a knee, basically what you're doing is just replacing the end of the thigh bone and the top part of the shin bone, and sometimes the back part of the kneecap through there. There are several different ways you can do a knee replacement. This is looking at a traditional knee replacement, but we also can use a robot to help do that. If you use a robot to help doing it, the surgeon is still doing the procedure. The robot can just help you make accurate cuts of the femur and the tibia in that area. After a knee replacement, we try to get you up with therapy the day that you have surgery. And depending on how you're feeling, if you want to go home the same day, you can. If you need to stay overnight, then we'll keep you overnight, then usually get you home the next day. Almost all the time we're able to get you to put full weight on your knee right away. With a knee replacement especially, it's important to get knee range of motion. In the OR, while you're asleep, we'll be able to get your knee completely out straight. We'll be able to get it to bend where your foot can almost touch your buttocks when we bend your knee while you're asleep. But obviously when you wake up and you've got your dressing on, you won't be able to do that right away. But it's very important over those first 2 to 4 weeks to get the motion back, and we'll work with you. I always suggest to my patients to get a little index card, and when the therapist comes to work with them, write how straight their knee is and how much their bend is, because then you've got a good scoreboard and you can kind of see how you're doing every therapy visit to see that you're improving. Typically after a knee replacement, we'll see you back in the office 2 weeks after surgery. That's the time when we'll get your stitches or your staples out, and then we'll advance your therapy. A lot of times the therapist will come to your house the first week or 2 after surgery, but usually by the first post-operative visit at week 2, then we can advance you to outpatient therapy. My name is Dr. Lloyd Johnson. I'm an orthopedic surgeon here at Alabama Bone and Joint. If you have any questions, please call us, come in and see me, and I'd be glad to take care of you. We have offices in Pelham, Clanton, and also in Centerville at Bibb County.